60 variables, roughly half from the economic sphere and half from the social sphere. We boil all that down into a single number and grade every state based on their family prosperity. This number allows us to do a couple of things. Number one, we can compare states. Which states are allowing greater family prosperity versus those that are not. In the 2017 FPI, Utah's ranked number 1 and West Virginia's ranked number 50th. The other thing it allows us to do is to compare a single state over time. Is it getting better or is it getting worse? And what it allows us to do for policymakers, for civic leaders, for religious leaders, is to provide a clear roadmap so that you can home in on the problems instead of wasting time perhaps on other areas where you may be stronger as a state. So the 2017 FPI results, as I mentioned, number 1 is Utah, 2 is North Dakota, 3 Idaho. Flip side, West Virginia's 50th, New Mexico 49th, and Mississippi's 48th. North Carolina, average. You're ranked 24th in the country. The display you see there is a data app that we have on our website, familyprosperity.org. We want to be 100% transparent. We talked a lot about transparency at this conference in terms of government. Well, we believe in what we practice, what we preach, and that all the data that we use here is on this app, scores, everything that you want to see, so that you can be certain that these numbers are reliable to use. Now here's a map of the results, which in the green shows you the top 10 states, the blue the bottom 10. First, I want to point out North Carolina being number 24, behind neighboring states Virginia and Georgia, but ahead of South Carolina and Tennessee. Now, one thing to note quickly is the green being clustered in the Intermountain West, Central Plains, and Texas, which are often by the left derisively known as flyover country, is actually the best areas to raise a family. The areas that are not, deep south, southwestern areas, the Rust Belt, and you can't quite, they're not in the bottom 10, but the Northeast fares very poorly in the FPI as well. Rhode Island is one that shows up, but Maine and Vermont also do very poorly. And we're going to talk a little bit about why as we go through it. Here, even though we're on our second edition of the FPI, we have been able to build previous indexes, so we have some comparability over time, back to 2012. And you can see North Carolina, when we look at these charts, you're going to see North Carolina is always highlighted in black, the U.S. average in blue, and then the two outlying states, high and low, are represented in these charts. And you see North Carolina's been slightly below the national average over this entire time frame, catching up here in the most recent years. Keep in mind that the 2017 edition contains data that's roughly 1 to 3 years old, depending on the data source, and that's just an unfortunate natural product of the data sources that we use. So given that fact, your landmark tax reform plan that was passed a few years ago is definitely going to result in improvement in your economy and other sectors, but really it hasn't shown up in the data yet. And it's going to even take a couple of years once you pass such large legislation before it begins impacting the economy. So with all of those lags, you can expect improvement in the future, but it may take some time to show up in the data. This is a more detailed view of what you just saw, the top line showing your total score and your ranks. I point out economics because over that time period, that was your worst performing index. Family structure was your best performing, but they kind of offset each other, which again leads back to looking at that chart that you've been pretty consistent over this time period. Now, one of the things that's difficult to convey in an index that compares to 50 states, which is a snapshot. Remember, each of these years is just a snapshot. What's hard to discern is the trend that snapshot is around. Is the trend getting better, or is the trend getting worse on all these variables? So this chart here shows you is looking over the entire time period of the data that we have, 2003 to 2014, and looking at the change in all of those variables, weighted in the same way that we did the index. You can see in the top line, the blue line there represents the U.S. average, is in the negative territory. And what that means is things like unwed childbirth, marriages, and on the economic side, demographics are all on average getting worse over time. So you'll see even Utah, number 1 ranked Utah, is in negative territory. So Utah's number 1, but they're number 1 because they're getting worse slower than everybody else. West Virginia, you can see, was way negative, well over 5%, and basically on these indicators, that state is collapsing in a way that is very unfortunate. Hopefully with the coal industry coming back under the new administration, some of that might be reversed. Now what I want to do now is walk you through the 6 major indexes that consist of the Family Prosperity Index. We have economics, demographics, family self-sufficiency, family structure, family culture, and family health. And I want to point out the highest and lowest sub-index of them. Here, on the economics major index, you have private sector share of personal income, real per household income, cost of living, entrepreneurship, and unemployment. Cost of living is your greatest strength here, but on the downside, private sector and per household income are your weakest points. Now, I said I was only going to highlight one, but because these two are integrally related, I wanted to talk about both of those. First, cost of living. This chart shows you, again, all 50 states, North Carolina highlighted, and the U.S. average there in blue. Cost of living is very low relative to the country, and that's a major strength. That allows your companies, for example, to compete with labor. You can pay somebody a very competitive wage that buys a lifestyle that, in my living in Northeast, you can't buy. You know, a starter home outside of Boston is $750,000 now. What can you buy in North Carolina for $750,000? It'd be a palace, right? Well, if you're a company moving from Boston to North Carolina, you immediately just gave every employee a massive raise, even if you don't change their salaries. And in fact, when I was in Virginia, I believe it was Philip Morris, moved from New York City to Richmond. Didn't change their salaries a bit, and those people came down and the housing market went bonkers. These people were able to buy anything and everything that they wanted. Now, on the flip side, your private sector, you can see, is not only below the U.S. average, but has been diverging. And that's important because next slide shows the relationship. We all know, right? The private sector is where wealth is created and income is created, contrary to what the deep state will tell you in Washington, D.C. And this chart here basically proves that. When you plot all of the continental U.S. states on this line, you'll see there's a direct correlation between the size of your private sector and per household income. And I pointed out North Carolina there, and you can see how important it is. Every 1 percentage point move on that line is about $3,500 for every household in North Carolina. So it's not an insignificant sum, and is one area that explains that poor performance. On demographics, we measure things like the age structure. So we have under 18 and over 65. Net natural population growth, which is the difference between the number of births and the number of deaths. And migration and fertility. Of course, North Carolina does very well on migration, does very poorly on fertility. So net domestic migration, this measures people moving across borders. And you can see it's been positive and well above the U.S. average for a very long time. I was kind of intrigued that New York is almost a mirror image of North Carolina. I was wondering if a lot of New Yorkers may be moving down here. The other thing that we measure is net income associated with these migrants. And of course, with strong positive migration of people, you would expect also strong in-migration of income with them. And of course, that is fuel for your economy. Fertility. So we all know that America is facing a major fertility crisis. Demographers are calling this demographic winter. We see it most pronounced internationally in states like Japan, countries like Japan and various parts of Western Europe. But it's now here in the United States. In the Northeast, where I live, Maine and West Virginia are two states where there are now more deaths than births in the state. There are about a dozen more states that are just a hair's width away from being in that same category. Now, you look at this chart and you say, well, I mean, North Carolina's not too bad. I mean, you were above the national average in 2000. Now you're slightly below the national average. Well, that's not so bad. And comparatively, that's not so bad. But I want to put this into historical context. What this chart shows is the U.S. average fertility rate going back to 1960, which is about as early as you can get the data. And what I've done is I've plotted the states where they are at in 2015, where they would be historically. And you can see right off the bat, in 1960, the decade, is when fertility fell the greatest. South Dakota, which has the highest fertility rate in our 2017 index, 2015 data, would only get us back to 1971-ish or so. And that's even before that steep drop-off. Texas and Wyoming does a little better. Tennessee and Washington are right at the national average. And so I indicated North Carolina is basically on that axis. So looking at it, North Carolina today has half the fertility rate that the U.S. average had in 1960. So that's how profound of a drop in the fertility rate in this country it has been. And that's why, as I point out, demographic winter is coming to more and more areas of the country. And when you look at it on a county basis, 1 out of every 3 counties in the United States now have more deaths than births. Mostly rural right now. In the family self-sufficiency major index, we look at number of prisoners within a state, the Medicaid system, welfare, government burden, which is both taxes and spending, and the level of charity. Here, North Carolina is a little schizophrenic. On the one hand, you're doing well on Medicaid, but not so well on the welfare index. And I think with Medicaid spending per person, it's not so much that North Carolina changed. When you look at this chart, you see that the divergence with the U.S. average began when? When Obamacare passed, right? And Obamacare enabled states to expand their Medicaid system. So I think what happened is more the U.S. average started leaving North Carolina as other states began to enact Medicaid expansion. Welfare, we can have 4 various measures that we use in the FPI. We look at the Earned Income Tax Credit, and we look at SNAP, formerly known as food stamps. And this is as a percent of population. You can see EITC is higher than the national average, as well as spending per recipient. SNAP as a percent of population started right at the national average in 2000, but has since diverged from the U.S. average. The only good one out of the 4 is SNAP spending per capita has been generally below national average over this time frame. Family structure. In family structure, we look at children in married couple households. We look at the marriage rate, divorce rate, state of households, which measures the level of marriage overall, as well as the size of households, and then families with related children below poverty. You can see you do best on marriage rate and most poorly on families with related children below poverty. This is what the marriage rate looks over time. You can see North Carolina basically tracking the U.S. average, but note the general trend is down. And we'll relate that to some other factors later because that's a very important development. And that's one of the things that the FPI is, as we move forward, is going to do more of, is this interrelationship between variables. So families with related children below poverty. Basically, the war on poverty has been the largest failure of the U.S. government in history. not only has the poverty rate stopped falling once we declared war on poverty, it's now in danger of actually going up. And I'll explain why. If you look in the U.S. average in this particular chart, it's moving upwards. And North Carolina over this time has been above the U.S. average, but consistently so. What's going on behind the scenes in this chart? Well, there's two types of families, right? There's married couple families and there's single-headed household families. The poverty rate for a married couple family with children is 8%. Anybody want to guess what the poverty rate is for a single-headed household? 36%. And so over this time frame, the composition of households has moved away from married couple and towards single parents. That's why you're getting this upward trend. So conversely, the only way to reverse this upward trend is to have more married households. And as overall for poverty, the missing component would be single people. So as this takes over, this dynamic takes over the entire poverty statistic, we may see poverty rising in America despite the trillions, tens of trillions of dollars we've spent fighting it. The family culture major index, we measure things like births to unwed mothers, violent crime, property crime, religious attendance, and educational attainment. That's higher educational attainment, associate, bachelor's, etc. You do most poorly on births to unwed mothers, and you do best on religious attendance. Church attendance, you see well above the national average. And I'm going to come back to this in a moment, why this is very, very important. But you can see where I live, basically is as atheistic as most atheistic part of the country. We're closing, I'm Catholic myself, and we close more Catholic churches than probably any other part of the country. Unwed births. Here you can see, this goes back to 2000, the general trend line is up. North Carolina's right at the trend line. But again, I want to put this in historical context because this is only over 15 years. If you look at it historically, you get this graph. In 1960, the unwed birth rate in America was about 5%. The average now is 40%, an 8-fold increase. This is the largest revolution to happen in the United States that basically we're not talking about, or at least not nearly enough. And so we've plotted various states. Utah is the best, but would only bring us back to about 1980. You see Minnesota up, Missouri's right at the national average. What's not shown in this graph, I got to find a way to do it, is there's some states now where that's approaching 60% unwed births. Unwed births is basically now the main driver for single-parent household formation. It's not divorce. Mainly because if you recall, the marriage rate's falling, fewer married people, the divorce rate's also falling. It's also falling because with unwed births, they're not getting married in the first place. And studies show that even if they're cohabitating at the time of the birth of the child, 2/3 of cohabitating couples will break up within 5 years. So these families aren't getting married. And then I think finally we have family health. We look at things like years of productive life lost. What does that mean? Years of productive life lost measures when somebody dies prematurely. The CDC uses the cutoff age of 75. If you die before then, that's considered years of productive life lost. So if you're looking at the opioid crisis in my neck of the woods that are killing our young people at a rapid clip, somebody dies at 25 from an opioid overdose, that's 50 years of productive life lost, according to this statistic. So that particular number is going to be rising for a lot of states as the opioid epidemic continues to, unfortunately, continue in many states. We look at risk behaviors. This is things like alcohol use, obesity, illicit drug use. We look at sexually transmitted diseases, infant survival, which measures the abortion rate as well as infant mortality, and then self-mortality, which includes suicide and drug overdoses. And you can see you do best in risk behavior and worst on STDs. I'm not going to show you all the graphs because there's a lot of factors that we use in these, but here I list them here. alcohol use, tobacco use, obesity, marijuana use, and all other drugs other than marijuana. In this case, North Carolina is either at or below the national average for almost all of those. Now here, I just want to make an exclamation point on the importance of religion. There is a very strong correlation between church attendance and lower drug use. So again, not to pick on New England, but the facts are the facts. New England's all in that upper left-hand quadrant where people aren't going to church, but illicit drug use is very, very high. Conversely, you have the Southern Bible Belt and Utah, very high church attendance and very low illicit drug use rate. And that's just one example. I mean, the literature tells us that religious people are happier, wealthier, and healthier than the general population. Sexually transmitted diseases, unfortunately, North Carolina is either at or above the national average on all of these. Chlamydia, gonorrhea, syphilis, and HIV diagnosis. I want to point out what gonorrhea is now on this, is it becoming a drug resistant. It's now on CDC's code red list for it. And if it does become drug resistant, it's going to be a very bad situation. Syphilis was all but eradicated a few decades ago, and now is making a huge comeback. I just want to know, I mean, CDC does a good effort, I think. I mean, at least their Twitter feed, they talk about this, but really, how many of you have read that STDs are classified under CDC as an epidemic? But do you read about it? You do, sir? One person in this room has read about it. Mainstream media isn't reporting on it at this at all, despite CDC's rather valiant attempts to get it out on their social media, because I follow their social media, I see it all the time, but it just doesn't make it into the news cycle. So where is all this leading? So we have the national report now. Now we're moving into phase 2 of the Family Prosperity Initiative, which is to take all this data and go into states individually and boil it down so that we can make it and turn it into a usable tool for policymakers, civic leaders, and religious leaders to make a difference in your respective states. We've now done this in 4 states, New Hampshire, Utah, Rhode Island, and Wisconsin. Next month, we'll be launching in Maine. We have an event with Governor LePage there. He's been very outspoken on the overdose crisis in his state, and so we're going to be talking about that, the role of religion and other factors. And I'm happy to say now we'll be coming into North Carolina in the next couple of months, working with Civitas, and we're going to really dive into that. I gave you a 30,000 foot view of some of the issues here, but we're going to dive into those more deeply, and that will enable us to pinpoint, we hope, some good solutions. One of the other things that we do in a deep dive is we take that national data and where available, we drill down to the county level so that we can get a more granulated view of perhaps where various hotspots are. Like we know, for example, that the drug crisis is in primarily rural areas. So we want to be able to see that dispersion. This chart here is the one we did in Wisconsin, from the study we did in Wisconsin, and it shows the net natural population growth by county. And as I said earlier, 1,000 counties, a third of all counties, now have more deaths than births. And this was a shocking graph to a lot of people in Wisconsin because it shows roughly a third of their counties now have more deaths than births. So it's that kind of visualization can really add shock value and really get people's attention. One other thing that we're working on with the FPI that I alluded to earlier is that we're trying to find ways to illustrate how all these factors are related. And coming soon on our national website, we will have a calculator where if you wanted to see if you changed your marriage rate by 10% up or down, how would that affect your FPI score? But what we want to do, as this chart is illustrating, is show if you were to change your single parenthood, say you reduce single parenthood in North Carolina by 10%, it would not only change single parenthood, we know that it would also decrease welfare spending. That would in turn decrease government spending, which would increase economic opportunities as well as household incomes. All of those things I showed you before right? Conversely, once you have that, those in turn feed the things that are creating single parenthood. The death of a spouse, incarceration, divorce, and left out in this chart is unwed childbirth, right? So these things are all related, and that's a long-term goal of the FPI, is to be able to show that. So in our calculator, hopefully soon, we'll start incorporating this, and you'll be able to change that, and then you'll see all these other positives. At least in this case, they'd be positives in your state. So that's my presentation. Please visit our website, familyprosperity.org. Sign up for our email list.